To this afternoon's daily update for COVID-19 in Arkansas and the public emergency that we continue to experience in our state. I'm joined today by Secretary Nate Smith. We have a fairly heavy discussion agenda today, but I want to start with a recognition of someone who lost their life because of COVID-19. If we could flash the picture up here. Chief Petty Officer Charles Robert Thacker Jr. was on the USS Theodore Roosevelt, contracted this virus, and he was hospitalized in Guam, and he has passed away. I spoke today with his dad in Fort Smith. He's from Fort Smith, graduated from Southside High School. He is 42 years of age. He was in good health, and I just want to recognize his service to our country and express condolences to his family in a public fashion. Now let me come back to our case report. Yesterday we had 1,620 cases. We add to that 75 new cases for a total of 1,695. We've had 37 deaths, and that remains the same, steady state. And then we've had hospitalizations have gone from 85 hospitalizations to 93. And Dr. Smith will elaborate on those shortly, but I now want to go to a couple of graphs that helps describe where we are in a different fashion. These are the number of new COVID-19 cases in Arkansas, and we're by custom we're going to continue to do this every briefing. And you see, these are new cases every day, and as you can see, we had that tall bar who had about 130 because of one of the outbreaks in the prison. It's gone down, and you can see where we are with the last column with the numbers. And if you go to the next chart is the hospitalizations that we have, and you can see where we are in our hospitalizations with about 92 that are currently hospitalized. And then another chart I wanted to show you, that this is the infection rate, which is the positive cases as a percentage of tests performed. And it also compares with other states. And so in Georgia, you see that about 24% of their cases report positive. And then in Louisiana, it's about 18% positive test results. Alabama is 12, and on, and you can see where Arkansas here is with this list of states. And so we're a positive rate of about 7 or 8% there. And so we are, I think it's another indication of where we are in terms of the spread in Arkansas. And I thought that would be instructive for everyone to see. As you all know, and I want to come back and talk about the gating criteria that the President announced yesterday. And I want to thank the White House and the President for his effort in opening up America again. And what it does for me as a governor is that rather than everyone charting their own path, there is some commonality that we can start with in the criteria that they offered. And so they set the criteria that every state can look at as saying, this is where you ought to be if you want to start opening businesses and releasing some of the restrictions. And then once you meet those criteria, you can go on into phase one, where you can relax some of the closures. You can take some steps to lift some restrictions. If you continue to beat the curve and you continue to have success, you can go on into phase two, into phase three. And I think this is a good model, and I like the fact that the President said every state has the flexibility to adjust as needed for their own state. And we do have to make some adjustments as we go through that. But it is a good starting point. And so here, these are the proposed state gating criteria. And the first one is symptoms of influenza-like illnesses reported within a 14-day period and a downward trajectory of COVID-like cases within a 14-day period as well. These, we meet both those criteria, and I'll illustrate that in a moment. On the cases, this is where we have more work to do because it requires a downward trajectory of documented cases within a 14-day period. And as you can see, we're still on the upswing in our cases, even though it on some days looks like a plateau. And then a downward trajectory of positive tests as a percent of the total test within a 14-day period. And this one we're looking good on as well, as I illustrated. The last set of criteria is in hospitals that we can treat all patients without a crisis care. And as we've illustrated, we have fewer than 100 in hospital care because of COVID-19, and we have a capacity of 8,000. And so that's a criteria and it says with robust testing program in place, which we're increasing every day. We need to increase our capacity in that area. And so those are gating criteria that we have. We have more work to do primarily on the cases, but we're at a good position to know where we need to launch from and what we need to work on. And if you go to the next slide, this is going to one of the points raised in the gating criteria, and that is the coronavirus-like illnesses in Arkansas. And so this is measured by the number of ER visits, and you can see from April 2 on through the present, the number of ER visits for these coronavirus-like illnesses or symptoms, it is on a downward trajectory. And so that is one of the gating criteria. And then what are we trying to get to, though? And that is to phase 1. And I want to emphasize quickly that even when we're in phase 1, we still need to, in public, we need to maximize physical distance from others in social settings of more than 10 people. We need to make sure that we're limiting our social engagements. And so these criteria will still be true in phase 1. Minimize non-essential travel and adhere to CDC guidelines. These are critically important as we continue into the future. And then if you go to the next slide, you'll see how this impacts, if we reach phase 1, how it impacts employers, which is we'll continue to encourage telework, but we'll return to work, which we are not a shelter-in-place state. And so we continue to work. One of the areas that you get to adjust this as you go along. But you close common areas where personnel are likely to congregate and interact. You are to minimize non-essential travel. Strongly consider special accommodations for personnel who are members of vulnerable populations. And then if you go to the next slide, you'll see a little bit more specific information. We're still in phase 1. And this is where schools and organized youth activities that are currently closed, they should remain closed even in phase 1. Visitors to senior living facilities should still be prohibited. We still must protect those in phase 1. The larger venues, sit-down dining, movie theaters, sporting events, places of worship can operate under strict physical distancing protocols. And then elective surgeries, which is important for us, and we mentioned yesterday to get back to, they can resume as clinically appropriate on outpatient basis at facilities that adhere to CMS guidelines. And so on it goes through phase 1 specific types of employers. Now, let's stop for a second and say that's where we want to get to. And we have to adjust that because not everything applies to a state such as Arkansas. But we want to start opening up and lift some of the businesses and lifting some of the restrictions. How do you get to phase 1? How do you get to phase 1? And where we want to be? And the answer is that we have to listen to Dr. Smith and his team. And as you remember, I created the Medical Advisory Committee composed of 7 health professionals that specialize in epidemiology, infectious diseases, our Surgeon General. They have been working diligently, and they have briefed me today, and I wanted to turn this over to Dr. Smith so that he could go not just through the cases, but also through their findings and their guidance and their criteria as to how we can get to phase 1 and when we can get there. And so with that, Dr. Smith.
Thank you, Governor. First of all, I'll go through the numbers briefly, and then we'll talk a little bit about the report. As the Governor mentioned, we've had 75 new cases reported, bringing our total to 1,695. Of those, 1,065 are active. We have 93 currently hospitalized. We had 14 newly hospitalized, and then we had 6 discharged, so we had a net gain of 8. We have 23 currently on a ventilator, which is 2 more than yesterday. We still have 37 deaths, no new deaths to report. We have 593 recovered, which is 45 more than yesterday. We have 228 healthcare workers who have been infected with COVID-19, and that is 5 more than yesterday. In terms of our nursing homes, we have 116. That's actually a decrease of 2. We did have a situation where we had some of the nursing homes used a lab that gave positive results that were questionable based on the symptoms, and so we had those tests repeated in 2 different ways. We had them both tested with another PCR test, they were all negative, and then we actually went back and tested them with a serologic test, an antibody test, and that was also negative. So we're confident that those cases were actually negative, even though they were initially reported as positive. So we actually had 2 fewer residents, and we actually had 8 fewer workers because of that adjustment. In terms of our prisons, this is where it gets a little bit complicated. I'll start with the Forest City federal facility. Their strategy at this point has been just to test positives, and they have had 7 new inmates, so they're up to a total of 57 inmates, total of 62 for that facility because of the 9 staff and the contractor as well. The CDC will be returning, I understand, next week, and then they will develop a more comprehensive testing strategy. For our Little Rock Community Corrections, we've had 3 additional inmates test positive, so we're at a total of 62, plus the 27 staff, a total of 89 for that facility. Now, the Cummins State Prison, we have been assisted in our efforts by the Little Rock VA Hospital. They began testing for COVID-19 in their lab this week, and because they have a higher throughput machine than we do, they have excess capacity. They've allowed us to use that to help specifically with this outbreak, but as needed. And so we've been able to do quite a few tests in a short period of time. At this point, though, we don't have an electronic connection between their lab and ours, and so those are having to be entered in manually. So we have a verbal report. We have of positives that are not yet in our totals. So we've actually had 83 new positive cases at the Cummins unit. That brings the total to 129, plus the so we have a total of 129 at the Cummins unit, even though those cases are not all reflected in the totals I gave you before. Some of those are in that, and then some will be reported tomorrow in our totals. Let me go ahead and turn my attention to the Governor's report from the Medical Advisory Committee for post-peak COVID-19 response. We used a number of sources to develop our report to the Governor, and From those and from other discussions, we identified 4 priorities for post-peak response. First is restoring the Arkansas economy in a timely fashion. The second is protecting our most vulnerable. Those include the elderly and those with underlying medical conditions. Maintaining adequate health care and public health capacity. The capacity that we had before this outbreak, this pandemic, was adequate for where we were, but now we need more. Particularly, we need more capacity for contact tracing in our public health sector. We need more PPE in our healthcare sector. And then fourth, preventing resurgence of COVID-19 in our communities. We do want to open up, but we don't want to get back to where we were in terms of increasing cases. So the governor's already talked about the gateway criteria for phase 1, and then we'll continue to utilize the Opening Up America plan and those definitions of phases. Where is Arkansas right now? Well, as the governor showed you, we are meeting some of the gateway criteria. We have seen a decrease in COVID-like syndromes. Our numbers of new cases are partly distorted by these outbreaks in the correctional institutions, but we expect that by early May we should see a downward trend and meet that gateway criteria. We have increased our testing capacity in the state and now are able to offer testing to all symptomatic individuals. And in terms of our hospital beds, ICU beds, and ventilator capacity, it looks like we'll be able to meet the foreseeable needs. Second question is, what can we do now while we're waiting for May 4th is our target date? While we're waiting for May 4th, is there anything to do except just sit around? Well, no. We need to keep doing the behavioral changes that got us to this point, that allowed us to flatten the curve and to beat those projections. The physical distancing, the cloth coverings in the public when that's not possible, hand washing, staying at home when ill, avoiding groups of greater than 10. Businesses can start to prepare and think through when we get to phase 1, how can you reopen in ways that allow for physical distancing and minimize the risk of COVID-19? What kind of policies are you going to need in place? What kind of supplies are you going to need? The elective surgical procedures is a particular concern to us. Because we've curtailed those, we've seen decreased numbers of patients in the hospitals, which means decreased revenues and decreased staffing. For us to be able to take care of patients with COVID-19 as well as other medical and surgical conditions, we need to have fully staffed and robust hospitals and other healthcare facilities. And so even before we get to phase 1, we're going to look at ways that we can start back some of these elective procedures in ways that are safe and don't facilitate the spread of COVID-19. We also, because we have taken a targeted approach rather than a stay-at-home order, we have a number of targeted directives that we've brought on incrementally. And so the advisory committee is looking at each of those directives and seeing how we can either pull them back or modify them even before we hit phase 1, but especially after we hit phase 1, how we can walk ourselves back in a way that is targeted and data-driven, just like we led the way in terms of a targeted data-driven approach to escalating those restrictions. And finally, our question was, should Arkansas take a statewide or a county level, a statewide or county level approach to reopening? We recognize that different parts of our state have been impacted differently, and that we have some areas where we have a higher concentration of cases than others. At the same time, we realize that even rural counties like Cleburne County, you can have explosive outbreaks of COVID-19. So we're going to need to respect those differences, but also realize we need to have a coordinated approach that it's not 75 different plans. It's a statewide plan, but respecting regional differences within our state. With that, I'm going to conclude my report to the governor. With the governor's permission, I'm just going to lastly take just a moment. I'd like for us to think about the people in our lives who we really need to protect from COVID-19, particularly those older individuals, those with underlying medical conditions. Remember them and draw motivation from those. The changes that we've made that we will need to continue putting in place, these are hard, but these are the people that we're doing it for. We have had 355 of our cases have been amongst those 65 and older, and 25 of our deaths have been. This sort of unusual tie I'm wearing reminds me of my mother-in-law and father-in-law who live next door to us. This tie is from Vietnam, and so are my in-laws. My father-in-law survived a communist detention facility and then escaped on a boat with his family. When he came to the United States, he was able to put both of his children through college and medical school. Today's his birthday. He's 86 years old, and he's an amazing gardener. I want him out there gardening and not worrying about getting COVID-19. With that, I'll turn it back over to the governor.
Thank you, Dr. Smith. Thank you for sharing that story of a loved one in your family. This is the Medical Advisory Committee report that I've asked for, and I'm grateful for the hard work that everyone put into that. Let me be clear that we're goal-oriented in Arkansas, and that our objective is to have May 4th as the date that we can start lifting some of the restrictions that are currently in place. To achieve that goal of May 4 and meeting the criteria that is set out to go into phase 1, we have to be able to manage the spread, to make sure that we continue to reduce that, and we need everybody's cooperation, as Dr. Smith said, in terms of the social distancing and sticking with the guidelines and not giving up and protecting one another. Wear your mask when you're out in public and you can't social distance. And we do that together over the next 2 weeks, then we'll be in a position on May 4th to say we've met that criteria. We're going to be able to have a little bit more of a normal life and start lifting the restrictions. Although we're still a long ways from a full opening that we would have whenever we get further down the road. But this is a start, and we need everybody's help to meet that goal that we've set for May 4th. With that, we're happy to turn over any questions.
In the roadmap for the White House gate criteria, in addition to the gate criteria, they have a section that talks about kind of the public health readiness in terms of being able to do testing, to do contact tracing of every new positive. Is that something we would need to build up our capacity to do before we go to phase 1?
We need to continue to develop that capacity. As you can see, our testing has continued to increase. We want it to be able to increase even more over the next 2 weeks. That is one criteria that is important to us. We do have, as Dr. Smith said, the capacity to follow up on testing of those that are symptomatic, and we want to be able to make sure we can do our contact tracing as well. We reported the other day that we've moved from 3 nurses originally in contact tracing to up to about 150 now. And I want Dr. Smith to know that as we look at the fall and further, we will train and put into place those that we need to accomplish the contact tracing that we need. And so we're going the right direction, all of those. Obviously, there's a little bit more work to do on each of them.
With the goal being May 4th, the peak was projected this week to be on May 2nd, I believe. So how would that be possible if we don't have that 14-day decline, with the peak being on the 2nd?
Well, I hope that peak comes earlier. And as you can see in some previous days, our curve has started to go down. And I think you also have to measure it from the standpoint like we have a burst in Cummins Prison. Well, that is in a shelter-in-place environment. It is in a congregate setting, and we might have others in that. And I distinguish where we are in terms of community spread and the control broadly in our community versus simply that we might be working in the prison environment or in some other environment that is a unique circumstance. So we'll continue. There's flexibility in that, but those are some of the criteria that I would evaluate it by. Dr. Smith, did you want to add to that?
Certainly, I'd like to address that in two ways. First of all, we've flattened our curve so much that to talk about a peak is challenging because it is so gradual up and it'll be so gradual down. We really won't know that we're past the peak until we're really quite far past it. So we're going to have to look at the curve with a lot of interpretation. Second, we're going to look at the curve also with and without these outbreaks that are in closed congregate settings, and that will give us more insight. And also, when we're looking at the alternate criteria, is looking at percent of tests that are positive, and we'll be looking at that over this period of time as well. Now, that's also distorted from day to day if we test a bunch of really high-risk individuals, for example, in the prison setting. But we can separate that out, and our percent positives of our tests have been steadily going down.
Do you have more of an elaboration on what the governor called a burst and positives in Cummings? And you said the total numbers didn't, the total that you give didn't include all of those at Cummings?
Yes, what I'm saying is we had great support from the laboratory at the Little Rock VA hospital. A lot of the test results that were done overnight were done in their lab, and those were reported back to us verbally. But since we don't have an electronic connection, all of those have to be entered in our system manually. And so by 11 o'clock, which is when we had that report, I didn't have all of those in there. They will appear on tomorrow's report. But I wanted to give you updated information on the Cummins outbreak based on our verbal report from the VA hospital laboratory and not leave that till tomorrow.
In terms of your explanation for the burst,
Well, we knew we had identified a number of cases in that one barracks, and we know that there had been inmates transferred out to other barracks before the first case was identified, and so we've gone to testing in other barracks, and so we've found many cases in other parts of the prison. I actually have a team on site at the Cummins unit today to help map these out and give them more detailed guidance on how to segregate the positives from those who have not yet been exposed, and we're working through that.
how many people in total have been tested?
The total number that have been tested, on the order of about 300. I'll give more details, though, tomorrow.
Worry about moving too quickly.
Certainly. You want to gauge it every day based upon the public health information. And so it's a balance. You want to, there's a limit as to how much we can live in circumstances that we don't normally live, that we restrict our movement, we restrict our social engagement, but lives are at stake. And so you worry about, you want to get it right, you want to have the right balance there. And so we set it as objective. I think as Arkansans, we can achieve that. We can start lifting some of these restrictions, but we're going to do it very carefully. And as you can see, on May 4th, we're still going to have the restrictions that you can't go visit a nursing home. You're going to have to be careful there. We're going to have the same restrictions in our prison population about visits. We're going to have to protect those those environments that are particularly vulnerable. We're still going to have restrictions in terms of not opening all the restaurants fully. There's still going to be restrictions there. And so we're going to take it a step at a time based upon the public health data. But when it comes to so many things, we think we can start based upon what we know now, set that as a goal and meet that criteria to start loosening these restrictions on May 4th. Yes, ma'am.
We talk about social distancing and things to stop the spread of COVID-19, but is there a firm plan for any of these prisons, since they're not technically able to do that, to stop the spread for them?
Well, you can isolate them in terms of those that have been positive, so they're not spreading it elsewhere. And then those that have tested negative, you still would isolate them because they still could have something that they could pass on. And so you put those protective measures in place in terms of the isolation, and that's what Dr. Smith has been working very hard on, and I'm sure he can give a little more detail there.
Yes, as we've said before, outbreaks of COVID-19 in a congregate setting like a prison are particularly challenging. Normally, if you had a large group of people and you had a case identified, those who were exposed you would send home for home quarantine. And if any of them became symptomatic, then you would test them. That's obviously problematic in an incarcerated setting. So instead of doing that, you basically can take broadly one of two approaches. One is you can just sort of wait for people to become symptomatic and then test them, and then remove them, put them in isolation. The problem is that we know that COVID-19 can spread from people who are pre-symptomatic, who don't yet have symptoms. So that's why we've taken the approach of testing all those who are exposed, those who we identify as being infected, then we can segregate those from those who have not yet been infected. And those who have tested negative, there's a chance that they might test positive later. We separate them from those who have not been exposed at all.
Let's take a question remotely. Is there a remote location question?
Yes, this is Melissa Ziegler with the Channel 11. Back to the Cummins unit, I was told by the spokesperson with the Department of Corrections earlier in the week that those 43 that tested positive, most of them were asymptomatic. Is that still the case with these additional inmates that tested positive?
That is correct. We are testing people who we consider to be potentially exposed, whether they have symptoms or not, and that's different than what we do outside of the prison setting for the reasons I just explained.
Anything else?
Yes, Governor. My name is Naum Dominguez from La Opinion newspaper. Some businesses did not receive the federal loan relief, and we have received reports that financial institutions are not waiving fees to small businesses that are struggling with overfees drops. Why the banks are not honoring what they say about helping the people in this crisis, and what are your comments on this?
Well, we certainly understand. The question is about struggling businesses that are either closed or they've lost business as a result of COVID-19. And the answer is the banks have utilized a large amount of SBA loan funding for these businesses in Arkansas, but that first round of funding has drawn to a close. And so you also have, and I would encourage you on the very small businesses to look to the Economic Development Commission website that has small loans up to, I believe it's $75,000 for small businesses to help them as a bridge loan. So you might check that out and see if there's anything more available there.
Has the CDC given the health department any new information or updates on the prison outbreaks?
In Forest City? Do you have any information on that? I think the answer is there's not any new news there, that they have taken responsibility for it with the Bureau of Prisons, And so they haven't called on us for any additional assistance, so that's really in their hands right now. Rush.
One of the criteria you're going to be looking at is the overall trajectory of positive cases. But in Pulaski County, it seems like whenever I look at it, their trajectory is, going up significantly more than other counties. So if you have a situation where you're kind of basing the decision on the whole state, but you have one area where the cases are still going up, how are you going to handle that?
Well, you could distinguish, but we've tried to maintain a statewide approach to it. But as you look at lifting some of the restrictions, you can break that down into other geographic regions, and I think we just have to measure that potential as to whether we need to lift some of the restrictions in all the rural areas that don't have any significant cases and keep some of the restrictions in place in other areas. That's something that we'll rely upon our health team as they evaluate that and the process we go through to lift those restrictions.
Sorry, go ahead.
All right, remotely, and I'm sorry to go back to you. Go ahead.
This is Drew Smith with the Times Record in Fort Smith. The fiscal session for the state legislature ended yesterday. Can you give us an update about if there were adequate cuts to the budget so that it wouldn't impact Arkansas's long-term economy?
Well, there were adequate cuts in the budget to make sure we have a balanced budget. And the question was about the General Assembly and the budget that they passed. In terms of what impact those cuts will have on the long-term economy of our state, the economy is going to be impacted by the slowdown of businesses, which impact state government. But I'm very confident with a balanced budget was passed that we're going to be able to continue needed services to those citizens that need it. We are going to have to tighten our belt, just like a lot of other people in Arkansas is going to tighten their belt. But I'm confident we'll be able to work our way through this with making sure that we can provide the services that people of Arkansas need, and I don't expect it to be a drain on the economy. Mike.
Surely people are asking you, what is this going to mean in the fall for Razorback football? What are you telling them?
Well, I've had a visit with Hunter Yurchek this last week. We'll have more conversations as time goes on. It's the health and safety of the players as well as the fans and making sure that they feel comfortable. I don't think right now anybody in Arkansas would feel comfortable going to a packed stadium. But I'm hopeful that whenever we get to July and August, there will be that comfort level, and that we'll also have some of the new measures in place and the accommodations that we might have to make from a health standpoint in those type of facilities. And so that all depends upon the progress we make as a state and nation, and then secondly, the partnership that the Department of Health will have with the sports teams and athletic teams across Arkansas to make sure it's going to be a safe environment for fans and players.
Governor, do you have
Have you given further consideration to steps to possibly do compassionate release or releases for those nearing parole?
I've received a letter from legislators asking me to look at that, but more importantly, that's something that I measure. Now, you think about it in Cummins, if you can't, I think that's the worst thing that could happen from a public health standpoint is to take someone that's in those Cummins barracks and release them out in the population because they have tested positive there in that environment. Secondly, it is a maximum security facility and they're there for a reason. But there's others more broadly in the prison system that I'll continue to review that based upon the need. what I want to do to make sure that if we have an outbreak or a positive in some other facility, that we're equipped to have the isolation areas and the areas to provide the health measures that are needed for the inmates. We care about them. We want them to make through this crisis the same as every other person in Arkansas that we care about. So we're continuing to look at those things, but that's not the first option we go to. Yes, and table.
Sure. We have a goal to begin phase 1. Do we have goal dates for the other phases as well?
Not in terms of dates. I will have an announcement tomorrow that will relate to how we can look further down the road to getting obviously to phase 3, which is what we want to be able to do. And let me emphasize that I appreciate Dr. Smith outlining some of the distinctions even on the criteria that was set and how that impacts a state that has such a flat curve. And you'll see that in each of the phases. And so to the public and to the media, don't look at each one of those phases that are very helpful to us and say that's what's going to happen in Arkansas. We were going to do it, we will do it based upon what's unique here and the response of industry and the response of the public and the public health decisions that we're advised to make.
Governor, do you have a comment on Arkansas casinos starting to see significant losses in tax revenue?
That's just one of the outcomes. The question was about casinos lost revenue to them, but also to the state. And so we were, I believe it was 35 million, that was the normal amount that we get in revenues for the casinos. That will certainly be down. There's also some of that funding was planned to go to our highway program. That will be down as well. But we'll just have to adjust accordingly because that's the reality of where we are right now. And we don't have a time frame where those will be opened up yet.
Is there anything under phase 1 of the White House plan that you definitely know that you wouldn't want to do, or are all of those on the table?
I looked at that and I didn't see anything offhand of something we wouldn't want to do, but we might have to take it a step at a time. And there's some areas that they might not have addressed in phase 1 that we might be able to address. I think elective surgeries is one of them on the phase 1 list. And as Dr. Smith said, you know, there may be, that's something that's very important to us, and that we're not going to be linked necessarily, and when we open up the elective surgeries, to every other criteria that's set in there, because that's something that's unique to our state, the rural state, and the expansive number of beds that we have right now in the state. Do you remember anything on phase 1 that caused you concern, Dr. Smith? One final question.
Governor, I have a question from Northwest Arkansas in the River Valley. This is Juliana Clifton with 5 News. I was just hoping you could expand a little bit on what it's going to look like for hospitals come May 4th. And also, could you touch on, will all the employees that have been furloughed or will be furloughed for our area hospitals, will they be eligible for that extra pay?
Great question. And in terms of what does May 4th mean for our hospitals, is that if we can meet all of our objectives, that means you can start planning and having the protocols in place and to work with our Department of Health to make sure we can feel safe in returning that. So I think it's good news for hospitals, but there's a lot of work to be done. And then secondly, in terms of the healthcare workers, that's a very specific list that's there, and I encourage you to go reference back to those, but that money certainly should be flowing because the money has been set aside for that purpose for our long-term care facilities. In terms of the money for our hospital healthcare workers, we still have to have the final guidance from Washington, D.C. to release that money, but we certainly hope that will be soon. Dr. Smith, did you have anything to add on any of that? And was there another question there?
Yeah, Governor, this is off the subject of COVID since we're wrapping up. But, you know, this weekend is the 25th anniversary of the Oklahoma City bombing. Would you like to say anything to our neighboring state as we go into this weekend?
Well, that was, I lived through it. I was in Fort Smith at the time, and I'll never forget the closeness that we felt to Oklahoma during that tragic bombing. And of course, it reminded us that a terrorist act can come from any direction. And that was the extreme right-wing terrorist that killed so many at the Murrah Federal Building in Oklahoma City. But it is appropriate to remember those families that lost loved ones during that time, and it reminds us always to be vigilant, to keep our families safe, and to protect ourselves against that kind of a threat. Thank you all very much today.